It is just a huge honor today to be at the Kentucky Dental Association's annual meeting with Jennifer Hasch.
Hash, like hash browns.
Like hash browns, BS, RDH, and Kyle Isaacs, who, did I say that right? Kyle Isaacs,
yeah.
RDH, who we've been in contact for years and years and years. You guys are down here. You gave 2 presentations today. What were you speaking on?
Well, this morning I did a presentation on silver diamine fluoride.
Which is, when I flew in here, the airport is SDF.
SDF. I know, isn't that cool?
So this must be the home place, the birth of silver diamine fluoride.
I know, I was so excited when I saw that.
And it was the Muhammad Ali airport. So was Muhammad Ali the inventor of SDF?
No.
Is that so you were talking about SDF today?
This morning, and a little bit about glass ionomer cement, silver modified art. And then this afternoon, Jennifer and I co-presented on mobile dentistry with her aspect mostly on the school-based programs and mine more on the nursing homes.
Well, wow, those are all some of the biggest controversial issues in dentistry. I mean, I never thought pediatric dentists would ever have anything to argue about on Dental Town for 30 years, but they found one with SDF. Why is that such a controversial hot button? Why do pediatric dentists either love it or hate it, and there's no middle ground?
Ooh, that's a great question. You should probably ask a pediatric dentist.
We
are both proponents.
I'm a dental hygienist.
Okay, you're both dental. Well, that makes you a neutral position. I mean, a pediatric dentist would bring a lot of
baggage
to the discussion. Why do you think they're polarized on that issue?
I don't know. The pediatric dentists that I know that have been using it have seen some great successes, and they've been able to reduce the number of general anesthesia and sedation cases that they're doing. It's not a cure for caries, but it sure is helping. So I'm not sure. I've never spoken to one that is against it, so I can't really speak for that.
Well, then you just need to get on Dental Town more often. I finally found the issue with your name. I had it with 2. I spelled it wrong.
Oh,
that
happens often.
That's the thing with Microsoft. You have to. There it is. There she is. Did I find you?
Yes,
is that
that's
you?
her.
Yeah, I was spelling it. So you're RDH, EP, BHS. What do all that even mean?
Well,
what does RDH, EP mean?
I'm an expanded practice hygienist in Oregon.
Oh, okay.
So,
Expanded practice in Oregon.
So I can go into facilities or patients' homes or schools, prisons, adult foster care homes. I'm actually working 3 days a week now in a medical office.
Well, back to the silver diamine fluoride. I think one of the most sad parts about actually the biggest advantage of being a man over a woman is that when you go 4.5% of Americans finish out their life in a nursing home. And if you go into a nursing home, it's all women and one man named Lucky. And these women are in there, and they say they get, the geriatric dentist, so they get 1 root surface cavity a month. So after grandma's been in there a year, she has 12 cavities. And I know dentists who after work will go to the nursing home with silver diamine fluoride. And a lot of people say, well, I don't want to do that because Medicaid or Medicare doesn't pay enough. But you don't do 1. I mean, usually these people need 8, 9, 10, 11, 12. But I think the most embarrassing part of dentistry is the nursing home population.
It's very sad.
For women.
It's just, I've had a lot of male patients as well. It's very, very sad.
She works in a veterans home too, and that's
in a veterans home too.
Yeah.
And you go in there, and it's so sad when you talk to the staff, and they say, "No, she's been in there a year and a half, and no one's ever visited her." And I thought, no one's ever visited her. I mean, it's.
Sometimes I'm the only one that day visiting someone. One of the things I said in my presentation today is, I get to hold someone's hand and look in their eyes and just spend time with them, and that is a huge thing for them. They don't get a lot of. Some of them don't get touched or hugged or or any attention other than the CNAs coming in and doing, whatever job they have to do.
Well, it just seems like a no-win situation because when I've spent a lot of time in some nursing homes in Phoenix, Arizona. It's a big retirement place, and because of everybody's dentures and partials, they want to cook just a carb fest. They just want to have cottage cheese, pumpkin pie, mashed potatoes. I mean, you look at it; it's just a carb fest, and that's what they want. And then when you watch the CPN or the LPN and the CPA do the home care instruction, it's a little bead of toothpaste, swish, spit in a cup, and that's it. I mean,
Right.
and you couldn't expect that one little lady to bathe, food, medicine, brush, and floss. I mean, it's never going to get done. So what's the answer to Root Service Takeda Nursing Home?
The answer is to have a dental professional, either a dental hygienist or a dental assistant, I think would work, in every single facility, working there every day, providing daily oral care. Today in one of my presentations, I talked about there was a study done, I think it was in Virginia. It was 147 residents, and half of them were assigned a daily oral hygiene aid to someone who provided oral care for that patient, that resident, every single day. I don't know how long it lasted. And the other half didn't get it, and the ones that didn't get it, they were 3 times more likely to die from pneumonia.
Oh my gosh.
So not only are they having issues with their teeth, but we know that connection between oral health and systemic disease. So we know it works.
So explain the connection.
With oral health and systemic disease.
Well, yeah. Why were they more likely to die from pneumonia?
Because they have more bacteria in their mouth and they can aspirate it. A lot of the patients in these facilities have dysphagia, so they have trouble swallowing and clearing bacteria. A lot of them have had strokes, and people who are post-stroke are more likely to have aspiration pneumonia because of that, as well as people with dementia. And the older people get, the worse their swallowing reflex is. So that's a lot of the people who are in long-term care facilities, people who have had strokes, people who have dementia, and people who are older.
Yeah, and that's a rough group to have good oral hygiene, brushing, flossing.
Right.
I mean, when you have dementia, Alzheimer's, stroke.
Dementia is really, really hard. So they're at that point, they are reliant on others to care for them completely. And like you said, the diet is really bad. A lot of them are on Ensure, which is really high sugar content. They're not chewing, so they're not getting that self-cleansing mechanism that happens when we chew. And a lot of them are on these carbs. Some places they have a lot of juice, and they're giving medicine with sugared puddings, Jell-O, applesauce things, throughout the day.
And then their medication causes xerostomia.
And then
So you have a perfect storm of dry mouth and carb loading, like you said.
and no oral care. And so their oral health goes down really fast. And because they have a lot of cavities and they have a lot of perio disease, that they're going to have a much higher bacterial count, in their mouths.
So you're an expanded duty hygienist.
Expanded practice.
Expanded practice. What does that mean?
And
you're from Oregon.
Not originally, but I lived there.
And
I've been there 6
and that's
years.
always been kind of a market mover. I mean, you're the first state to legalize marijuana, right? I mean,
I think that's
Arizona.
Colorado.
Colorado legalized
Colorado.
it
First.
as recreational before Oregon.
But were you like number 2 or?
We were close up there. I can't remember if it was us or Washington State.
Okay,
first.
Arizona just the last election they voted down again. I mean they but anyway, but
I don't know. I don't deal with that.
But what I don't understand is it's funny when they started to just pass hygienist, your profession. It was met with the same controversy.
Oh yeah.
And Bob Barkley had to go around the country telling these people, well, why can't she get why can't you do this? And they said, well, I'm so busy pulling teeth, making dentures, I don't have time for this.
Well,
and
that's
now,
a great point.
Yeah.
I mean, everyone should be working at the highest scope of their license. That's where we are most productive. That's where we are most effective. So why should dentists go into a nursing home and brush teeth once a week, like the High Life program? They shouldn't. That's the answer. They should be working at the top of their scope. Let assistants brush teeth. Let hygienists take care of prophylaxis and the other things that we can do, sealants, SDF. When we're all working at the top of our scope, that's when we're being most productive and most effective. It makes sense all around.
But they're fighting. Well, what are your thoughts on the dental therapists? Is that come to Oregon yet?
We don't have dental therapy there. We do have the DHAT, the dental. Oh my gosh, I hope I remember. It's a pilot project that's happening, kind of like what they're doing in Alaska, where they have the native
on the reservations.
People.
That's
right.
in that dental therapist, or
we don't have.
It's not called dental therapist, but it's something.
Well,
similar.
it's a technical program.
Yes.
So it's not a mid-level provider
No.
where someone goes back to school and receives further education and has a master's or something like that, which is the Minnesota model, if you're familiar with that. The DHAT is a specific technical dental therapist that has a very limited scope of practice and is not formerly a hygienist, but is trained to go give relief to a population who is suffering, which is, in the Indian Health Reservation.
They're from that culture, so it's the
the person's from that culture.
Yes, and then they're trained. They don't have a dental background, and they're trained for a couple of years, and then under a dentist for a certain amount of hours. I think they have to work with
So what
the
do you think of
dentist.
that program?
I don't know if I know enough to make a comment on that. Yeah.
I think there's a lot of need in that population. I think we can all agree with that. And so I think for all of us to be nimble and creative with our workforce models is good. I definitely think technical programs can be more challenging for, dental procedures than a CODA accredited educational institute. But I think we have to answer the need. So I'm willing to support anything that's answering the need as long as it's quality care.
And personally, there are times when I would like to be a dental therapist because my patients in nursing homes, could benefit from that. But I don't want to. I'm like getting old, and I don't want to do that. And actually,
You're getting old and you don't want to do that. What do you mean?
I'm getting old.
How old are you?
Old enough to know better.
Well, I'm 57.
I'm older than you.
You look younger than me, so you must be
I'm
eating your
58.
vegetable. You're 58? Okay.
Yeah.
So what do you mean? You're getting old, so you don't want to go into these?
I don't want to be a dental therapist. I don't want to go back to school
okay.
do that. And I really like the prevention aspect of dental hygiene. That's really what drives me. And so I'm not into wanting to extract teeth and do fillings. So it's not my thing.
I guess what I was going at, what do you think of DHAS? Is why I graduated in 87. And I remember when the Colorado, which was the first state to legalize recreational marijuana and the first one to recognize independent hygiene practices, and 7 went out on their own. And you would have thought Chernobyl had blown up again. And among all 50 states, and I just started to wonder, why is it such an emotional on-ramp? Because, of course, I was lecturing there, so I went early, rented a car, drove down there, and it always was a hygienist in a town of 1,000. The only way she could afford to do it was she got rid of her dining room table and got a dental operatory. And if she saw something she's concerned about, she wrote a note, and that guy would drive an hour up the street. And that dentist says, "I love that lady. She sends me a broken tooth, a cavity." And so what I could see working was perfect, but the hormonal reaction.
So I'm curious, you as a dentist, what's your perspective from the dentist side?
That they're just it's some emotional trigger word. Like
nobody's died, right? In Colorado, did anybody die because of dental hygienists?
No, but I go to a resort, and so you go on a cruise ship. Well, I can go get a facial. I don't want a facial. I can go get my mani-pedi. I don't want a mani-pedi. And I'm just like, can I get my teeth cleaned? Oh no, that's illegal. I mean, you go to any of these resorts, again, your wife's in there getting a mani-pedi facial with cucumber slices put on her eye, and a man just wants to go get his teeth cleaned. And the access to care, I think
there's too much red tape. And if there's that much red tape for you, imagine how much red tape there is for someone struggling with poverty or a rural area. There's a real issue here. And so I think we need to spend less time on the turf war, so to speak, and more time on bringing the care to people who need it.
Well, and look at the Alaska deal. It's like all these righteous dentists, and I'm saying, okay, at the end of the day, so you're saying that no care is better than some care. Really?
Preach.
I mean, they're like, well, if they're not, it's like, dude, this is an area that's larger in Alaska. This is an area that's larger than some U.S. states with 0 dentists. So can we send in someone who's not quite somewhere between a dentist and 0? Oh, no.
Unacceptable.
It's
it makes no sense.
They make no sense.
None.
Yeah.
So I'm going to tell you, in Oregon, we started out the expanded practice hygienist with a much more limited scope of who we could see and where when it first came in. And I don't remember the exact date because I wasn't living there then. I want to say maybe around 97. And so as the years have gone by, we've gotten more and more of freedom of who we can see and where. And so that's opened up the availability for these vulnerable populations for someone to go and provide care. I see people in facilities that no one's looking in their mouths and they're not getting the care and nobody has any idea what's going on in there. And people aren't complaining, maybe they don't feel it, maybe they don't know how to express that.
Or they can't communicate at all.
And I'll tell you, the craziest one is, you remember that lady who in Houston who ran over her husband 3 times for... You remember
I don't remember.
Her husband was an orthodontist, and
I don't remember that
she
story.
saw him walking out of there, so she rode over and killed him and everything.
Oh my gosh.
Wow. She was a dentist in prison for like a decade. They don't even let the prison dentist do dentistry. She kept saying, well, I'm in here. Can I be their dentist? Can I do... No, you're not a licensed. You're a felon, so you can't do... It's like, where does the insanity... I mean, at least you should let all the dentists and hygienists in prison at least treat their
They're
own...
still licensed.
Their own inmates, but
That's
they can't
insane.
because...
I had no idea.
It can't because they're a felon. So the minute you're in jail, you can't
lose
do
your
a
license.
cleaning on your roommate. And here they had a dentist in jail for a decade that the population could benefit from. Yeah, so.
It'd be interesting to see how many abscessed teeth led to infections that led to hospitalizations during that time in that jail.
So you lecture on silver diamine fluoride, and
this afternoon we did one on mobile dentistry. So Jennifer highlights the school-based programs.
So is mobile dentistry, is that really, is that a thing now? Is it taking off?
I think so.
And what is mobile dentistry? Does it mean that you're driving down the street with an operatory behind you?
It can be that. I think it also encompasses portable dentistry, where we take equipment into a setting and use it inside. There are lots of different models. I think teledentistry is one of the things that is incorporated into a lot of the mobile programs. We just discussed best practices and how things are moving.
Well, which one of these mobile dentistry models do you think is going to be the winner?
I think it depends on the population that you serve. For us, we're in a school-based program, and we're only intending to stay within, 10 miles or less of our fixed clinic so that they have a restorative home to go to if there's need. So for us, it makes more sense to have small equipment that we can take in, be within the classroom, or the nurse's office or wherever we set up that day. But there are outfits that want to see a whole state of kids. And if that's the case, they may want a big rig with 3 chairs in the back. So are you doing preventive or are you doing restorative? I think that makes a big difference. What type of facility you're going to and the patients that you're giving care to, it all comes into place.
What are you doing?
Excuse me. We have portable equipment.
What state are you
inside. We're in Kentucky.
Okay, you're in Kentucky, you're in Oregon.
Right.
So you sell tobacco and she sells weed?
Neither.
Neither? No?
I do anti-tobacco cessation counseling.
In Kentucky? In Kentucky?
I do,
I'm
yes.
surprised they don't kick you out of the state. Isn't this the home of tobacco?
It is indeed, unfortunately. Yeah, I sit on the steering committee for the Kentucky Oral Health Coalition, and we do a lot of advocacy around smoking and vaping, which is the new, risky. Yes, so
Really bad.
it is definitely a thing, and we're always, neck to neck with West Virginia on the amount of edentulous adults because of our tobacco use.
Is Kentucky 1 or 2 in edentulism?
Right now we're 2.
And West Virginia's 1?
That's right.
In edentulism.
In adult edentulism, that's correct.
And what rate and how high is it?
I don't know that statistic.
I know for the USA, it's by age 64, it's 10%. By age 74, it's 20%.
We must be higher than that to
Is
be
there higher
number
than that?
1 and number 2.
And you think that's mostly correlated to tobacco use?
Yes, I think so. And it also has a lot to do with the lack of oral health literacy and poverty in rural areas, not having access to care in rural areas.
Yeah. So, what are you doing with mobile dentistry in Kentucky?
So I work for Shawnee Christian Healthcare Center, which is a federally qualified health center in the west end of Louisville. And it's the historically segregated area of Louisville. Louisville is the 3rd most segregated city in the nation. And a lot of it had to do with our red zoning laws and where African Americans could purchase homes. And it's still pervasive today. And there's an access to care issue. There's a food desert issue in the community. And so I work in the clinic over our staff. We have 5 operatories, and then we also have the school-based program that goes into 10 schools right now we're within an 8-mile radius of the office.
And what do you do? What is your goal when you go in the schools? Oral?
It's preventive focused. So we do screenings, cleanings, fluoride, sealants, x-rays. We have a dentist with us. Because that's the law in Kentucky.
And you do that with a mobile dentist? So you bring the chairs, so what? You get them out
Pack
the
it
trunk
up,
of your car?
put it in the Jeep Grand Cherokee.
Yeah?
Head to the school and unpack it, set it up, see the kids. If they do have restorative need, they're referred back to our office. Most of the schools are actually within walking distance, so we cut out those transportation
you'll do
barriers.
cleanings, but you won't do a filling or an extraction?
Not yet. We've talked about it.
But so how's that, what's the fold-up dental chair? Is it
We use a Dental Works unit. That's a brand.
It's called Dental Works?
Dental Works.
I gotta see
There's
this
some
thing.
different.
There's all kinds of different brands, but that's what we use.
What's that?
DNTL WORKS.
Oh, okay. Yeah, I've heard of that.
Yeah, they're out of Colorado.
They also
Yeah.
make the mobile compressors
Yeah.
that we use.
So I use the
And-
Pro Seal, which is one of their units, and then one of their chairs, which is also portable. They have all kinds of different equipment. So if you're interested in starting a mobile dental program,
It's called DNTL Works. And why a compressor as opposed to just going electric?
Oh, you need a compressor. So it looks like a suitcase, and it has air, water, suction. Some of them will have a high-speed handpiece attachment. Most
you
of
can
them,
customize it based on the services
Yeah.
you want to provide.
I mean, you can have one where you can attach an ultrasonic, for scaling,
So you still need an air compressor for that.
for sealants,
You need high-speed suction to keep a dry field for sealants.
Yeah. And the compressor is the vacuum too? Or?
Yeah.
Yes. It's
It
all
has-
in one suitcase. We have it here. We brought it to our course. So if you want to come play with it later, you can.
How much is it?
Oh, they can be
It's
5,000.
customizable depending on what you want, but I would say they
5 to
range
8.
between 5 and 9.
I want to see you try to check that on this carry-on on Southwest Airlines.
Oh, my God.
I think they
I don't
do
think-
when they go on mission trips.
Yeah.
I've had some people tell
Really?
me they take it to Honduras.
Yeah.
Yeah.
So we talked about mobile dentistry, SDF, expanded function. What there was another
Access to care,
access
social
to care,
justice.
social justice. That was the
Yeah.
one.
Like people who don't get care and they can't get it. Why does our country have it so that some people are, I don't want to call it the have-nots, why everybody should, I feel that everybody should have access to health care. And included in that should be dental, because our mouth is connected to the rest of the body.
And
Agreed.
what are your thoughts?
I think probably the best way to start the conversation about oral health as a social justice issue is to remind folks that where there are food deserts, there are also health access deserts. And so there are specific communities.
What is a food? The second time you said food desert. You said there was a
Right.
food desert in the west side of Louisville.
Right. So that means low access to healthy food choices, whether that be grocery stores or farmers markets. And so a food desert is an actual designation by the federal government, as is a health access desert, actually. You can look up right now on the National Health Service Corps where there is a dental service provider shortage area in your city, county, state.
And what site is that on?
National Health Service Corps.
National.
So nhsc.org.
www.nhsc.org.
That's correct.
.org will tell me where there's
HPSA scores, health provider shortage areas, and they have one for dental providers, and they'll tell
the
you
site
what
cannot
counties.
be reached. So NHSC.
That's it.
Huh.
Try Googling it.
Well, what is the NH? Here, I'll.
It stands for National Health Service Corps,
I think even
or it might be .gov actually.
what I've
Oh yeah, it probably.
It's
is.
probably .gov.
What I've seen too is, even though you might have a dental home near where people live, often I've noticed in Oregon, there aren't enough providers to take care of the needs of all the Medicaid patients. And we do have an adult Medicaid dental, for people who are at below a certain income. So I would call that even though they're there in the area and close, but if you can't get into an office for 4 or 5 months.
National. What did that stand for? National Health
National Health Service Corps.
Service Corps.
Yeah, CORPS.
Oh, Corpse. CORPS. So, do you consider me deaf and dumb, or just?
We're just walking you through.
We're just walking me through.
Step by step.
I'm
We're
gonna find.
patient
Okay, there it
folks.
is. So it's NHSC.HRSA.
Oh, okay. So
Dot
it's
gov.
it's
So-
within HRSA. That
And
makes
and
sense.
then where do I find a shortage of dentists?
So just put in the search box HPSA.
HPSA.
That's going to give you your health provider shortage area. And they probably have a whole page.
Health professional shortage area.
Yep.
Aren't you good? And that includes dental.
Yes, it breaks it down by the type of provider. And you could
How
probably
do you
even.
do that?
Let's see here.
Because usually dentists aren't, we're not real doctors. It doesn't. It's not covered
Right,
by-
that aging silo. I'm gonna actually search dental PSA,
And what does the PSA mean?
provider shortage area. I don't see the list, but I can give you the link later.
Can you email me the
I'd
link
be
later?
happy to,
Or
yeah.
can you post
I can
on,
tell you this.
Email it to me or post it on Dental Town or both?
Yeah, I can tell you
because they're
that.
always asking.
Of course.
They're always saying when they come out of school, so business is supply and demand. Where am I needed? And
Right.
you go.
This is a great place to go. And we have dental students that rotate through my clinic, and I point them in this direction all the time. It's been a while since I've been on this page. But health centers actually get scored by this system, this National Health Service Corps system. The HPSA score allows them to offer loan repayment programs, for example, to dentists and hygienists based on how high the score is. So there are FQHCs, health centers in West Louisville, that have a score of 14, which says it's high, which basically means there's not a lot of dental professionals in that area, and or the dental professionals that are in that area don't accept Medicaid, and or the dental professionals that accept Medicaid have a long wait list or will only see children, and on and on and on and on. So there's all kinds of barriers that limit access to care. And the federal government tracks that and incentivizes providers to work in those areas to answer that need.
And at the bottom, at the end of the day, is this mostly economics? Is poverty, or is it other factors? You said.
I think it's poverty. I think it's racism. I think it's the history of segregation in our nation. I think it's all the isms, really.
Is it immigration?
I think there's a huge immigration factor, especially for those folks that are undocumented in our nation. There's a trust issue with seeking care at this point.
Yeah.
They're afraid to fill out paperwork, afraid to be seen by health professionals.
Right.
And, kids that may be citizens who have parents that are undocumented aren't accessing care either. And so I think there's
issue.
Yeah, there's a lot of problems with that.
Yeah, it's you never supposed to talk about religion, sex, politics, or violence, but I have an MBA, and I love two things: economics and dentistry, and I love them both.
Well, they go hand in hand.
And you ask anybody with a PhD, what made America what it is today? And they say 500 years of immigration from every corner of Earth.
We're all immigrants.
And then you say, so what would be the best thing to do for the economy? And every one of them will say, open back up Ellis Island. And then you talk to every American. So you want to open back up Ellis Island? Hell no. And it's like,
well, there's this false belief that there's one pie, and I get a piece means you get less of a piece, right, type of thing. When in fact our strength is in our diversity. And until we admit that and embrace that, I don't think we're gonna have a chance.
Well, I actually think the country has absolutely been in decline ever since after 9/11. We choked off immigration, and
no decision made out of fear is a good decision.
Yeah,
sure.
And so now I look at some of the greatest minds in the world that used to come to America, and now they're going to Canada. They're staying back in India. They're going to South.
It's heartbreaking to watch.
They're not coming here. And you know what the also lesson is? Do you know what was the America before America? It was Argentina. The Irish diaspora, they were all going to Argentina because it was the new America. And then what did they decide to do? They decided, we want to go back to the colonial system where you work on my land to give me half your crops. And they're like, that's why we left. So what did they do? Argentina would have been the United States of America. And on that one policy, they said, well, forget this. And all the Argentinians, all the Europeans that had gone to Argentina all started going to the United States. And it's just like history. I guess history always repeats itself, and it's time for the United States to just shoot itself in the foot.
I sure hope not. I think we can rise to the occasion. I call myself a patriot, but I think there are some scary things going on right now. But I have faith in my fellow American to be compassionate and open to diversity and to make decisions out of science and fact and research and what is proven rather than fear or hyperbole or unfortunate assumptions about other people.
Well, they're closing the convention hall. You hear that? So on that note, I love it. You should never make decisions based on fear.
That's right.
And my gosh, thank you so much, Roger. And by the way, we've Dental Town has 250,000 members. We've put up 400 online courses. They've been viewed almost 1 million times. The millennials love to just be able to watch a course an hour at a time. I would love to have some courses from you on this. I mean, all your hot buttons. I mean, everything you just talked about is a political no-no. So I'm Dentistry Uncensored. So that's what I want to highlight. So
well, if we don't talk about things and come to common ground, we're never going to make progress. And I think we have more commonality than we have differences. So coming to tables, having discussions, talking about difficult subjects, and working together is the only way we're going to make any progress. And that goes in dentistry and in anything.
And again, so like the dental therapist, the end of the world, hygienist doing fillings, the dental therapist. So I'm out there on the road. So when I'm on the road and I hear this, I find out where are they, and I go there. And so what the dentist say that I found with dental therapists? Say, oh my God, I don't want to do my cleanings. I got 2 hygienists. And I don't like doing fillings. So now I have 2 dental therapists doing the fillings. So now all I'm doing is root canals and extractions and dentures.
Working at the highest scope of their practice.
Scope of the practice. And then
it's
all
a practice
the other
builder.
dentists around the world, think that's going to bring down the profession. I'm like, how come everything that's going to bring down the profession, I always find a dentist totally loving it.
Do you think maybe it's based out of fear?
Oh, absolutely.
Scapegoating.
And then the roots of your entire profession was Bob Barkley, who died in his own small aircraft, on his way lecturing, trying to convince these dentists who did not want you guys because they were so busy doing immediate dentures that you were a threat to their profession. I mean, and then you just got to ask yourself, and what I'm most concerned about now is now that I'm old, I'm not as old as you. Don't get me wrong here. I'm just a spring chicken.
I was waiting for that.
Spring chicken. But I'm at the, my 4 boys have made me 5 grandchildren. I don't want to die and have my grandchildren go to a dental office that's owned by a corporate Wall Street guy saying, more crown, you should have upgraded that filling to an onlay to a crown, and why do I want my, at least my granddaughter to go to a dental office where it's owned by a dentist. Is that too
I think
tribal?
Conservative treatment plans are the goal, and I think even more than that, prevention is the real goal. And I don't think, and I don't think anyone argues that there's enough disease to go around here. If you're in the small confinements of a high income private practice on a prominent area of town, I implore you to step out of that office, go to a rural area or an urban area, and volunteer one time, and the mouths you see will change your life. Not just your practice, your life. I've been to Honduras, Jamaica, on mission trips. I've seen mouths worse in the west end of Louisville and the eastern parts of Kentucky than I have seen in third world countries. We have people suffering right next door.
Yeah.
And so if you're feeling like your business is threatened, then you have a real misconception of our nation's oral health.
But do you think my specific concern that a dentist office should be owned by a dentist, do you think that's legit, or do you think that's tribal?
I think it's getting more difficult for the private dentists because of the bigger corporations. They can do things from more cheaply, and the dentists that are attracted to that business model, they don't have to worry about hiring and firing and buying supplies. So I don't know around here, but in Oregon we have a lot of those corporations and DCOs.
Yeah, I think Medicaid and Medicare make it really difficult for private dentists to offer services to those populations. I think DSOs and health centers are sometimes more incentivized to offer services and get higher reimbursement. And as you know, Medicaid reimbursement is pretty low. And so that's a real issue for sustainability for a private practice.
Yes. And that's why a lot of them
I don't really have
Medicaid.
a dog in the fight of whether a dentist should own a practice or not. But I can say that it's really difficult for a dentist to own a private practice and see an at-need population because they're not covering their costs or their overhead, and that's a poor business model. So how do we level the playing field so that we have more capable providers seeing the populations that need to be seen? I don't know all the answers, but I know we need to come together and come up with some solutions like yesterday.
I think one of the things that would be really helpful is to, and Jennifer and I, we've been on a group together about this, is getting all the dental hygienists to be able to work in medical offices and get care earlier, educating parents in pediatric offices, because if we can prevent disease, then we're going to have happier patients, and we're going to have people who aren't going to necessarily be having to go visit the emergency rooms. We're going to save money. And so early intervention and connecting and collaborating with the medical providers. And not only that, it's going to educate the medical providers on who we are as healthcare providers, that just because we're in the dental field doesn't mean that we're not healthcare providers. We are.
Last but not least question is on Dental Town, there's a long thread about, we all know that smoking's really bad for you. There's no question with that. But isn't vaping a little better than smoking?
No, and I have.
She's laughing.
I'm laughing.
My question was
Because-
that dumb. She just had to laugh at that question. But
So we're already seeing, how long has vaping been out? I mean, I don't know, 10 years maybe? And we're already seeing explosions in people's mouths, popcorn lung. We have no idea what's in this stuff. It's not FDA regulated. There's huge high levels of nicotine.
Natural
There's
flavors.
research still needs to be done, but a short answer is no.
Propylene glycol.
It is not better
Yeah,
than tobacco.
wow.
Yeah, there's all kinds of
Chemicals are chemicals.
and the natural flavors, and the sad part is, and I know that I think the cigarette companies have done this too, is they're marketing towards the kids. I mean, if you look at the names of some of the products and how they market them to look, cute and
Some
the flavors,
kid a couple
bubblegum
weeks
flavor,
ago,
whatever else.
overdosed on nicotine from.
And if you see what they do in Asia and Africa, I mean,
those warning labels are
it
intense.
should be.
Have you seen it?
No, I mean the predatory practices where
the
they go
industry.
into villages and give out free cigarettes until they're addicted. Then they go back. I mean that, and then to know what will happen to their lives, and to then to realize they're publicly traded companies.
Mm-hmm.
I mean they're
That's corporations
it's
over human beings,
corporates
and it's not okay.
murdering people.
Yeah.
That
For profit.
Like now we look at some things like today that are bad that we didn't see 50 or 100 years ago. I think 50 years from now, people are going to sit there and say, "Really?" And everybody just looked the other way. I mean, they would go into an entire country, get half of them addicted to this, and then you look at the mortality. I mean, it's just like,
Yeah,
wow.
it's heartbreaking.
I mean, you know what's going on when it's a gun with a bullet and it's a war, but just a little slower process.
Yeah,
but ladies,
padding
thank
their
you so
wallets.
much for all that you do for dentistry. Thank you so much for stopping by the booth and talking.
It's been
to
a
my
pleasure.
Well, we
homies today.
hope my goal is to inspire as many people to step out of what is comfortable for them and start doing something to bring care to those in need, because there are a lot of people in need.
And if they were looking for where to begin, where would you tell them to go?
Well, they can contact us.
I'd
We're
be
always
happy to talk to
available.
anyone. And then also, each state has an oral health coalition. It's not organized
You should
dentistry.
write an article for Dental Town with all this stuff.
I'd be happy to.
Yeah, we'd love
Yeah.
it.
But if you're wanting to get involved and not sure where to start, reach out to the folks in your oral health coalition. You just Google it. You can find
Oral Health
people
Coalition.
that are passionate about access to care and about making an impact within your state.
And that's philipmorris.gov/oral
Kill yourself.
/kill yourself. Thank you so much for coming
Nice
on
to
the show
talk to
today.
you. Yes,
Thank
thanks
you
for
so
having
much.
us. Yep.